It's been a critical concern through the pandemic, the resources to fight it. We've had conversations about PPE and whether there'd be enough of that. Same with vaccines. Recently, though, the resource conversation has centered on human resources, like the people working in our hospitals to treat very sick COVID patients. Unfortunately, the last 18 months has burned out a lot of medical professionals to the point of leaving the entire field. It makes you wonder, are nursing school students thinking twice about going into the field of nursing? For the most part, the answer to that locally is no. And because of COVID, nursing students, or I should say because of COVID, nursing students are learning more and experiencing more than they ever have.
It's fair to say the lessons in Lab J could one day save a life.
We actually have 6 beds that we use.
Students in the Boise State School of Nursing work here in the simulation center to fine-tune their skills.
These beds are set up like a regular hospital room, so we've got working equipment, working air, we've got mannequins in there.
Kelly Connor, director of the simulation center at BSU, will tell you the mannequins are far more than test dummies.
They are very lifelike. So this is Eduardo Bishop.
Yeah, that doesn't feel good.
Yeah, it hurts, but it's going to help open those lungs up.
Students like John Dye are getting simulated reps to get them ready for real-life work.
Well, you know, I originally was a geologist, and I worked in the oil fields in North Dakota and Wyoming and Montana.
In early 2020, Dye decided it was time for a career change. And what a time he ended up picking to get into nursing.
I feel like it's going to be one of those things that we tell our grandkids, you know, like, yeah, I became a nurse in the middle of the COVID pandemic, you know.
That COVID pandemic forced faculty to get creative and consider how to best approach training nurses that seem destined to deal with COVID.
It's been a time of a lot of creativity and generating new tools to use with students. So that has been very fortunate. Even though it's turned everything on its head and it's been difficult, we've learned a lot of things very rapidly because we had to.
Blood pressure is good.
While the experience here is crucial, students take one step further as a part of their coursework, going inside the hospital to learn on the job.
The hospitals, all of them, especially St. Luke's and St. Al's, have been really proactive in trying to integrate students into the educational scenarios that they can.
Max Veltman is the clinical coordinator for the program at Boise State. He says the work inside Idaho hospitals during COVID helps students develop a unique skill set.
It's training and practice so that at the end of the semester, prior to graduation, they've really taken on the role of the nurse so that they are, you know, feeling pretty confident that they're ready to go. Graduate a few months later, they're on their own.
So you need to just breathe in nice and steady and try to get this disc as high as you can get it. And if it makes you cough, that's okay. You can take some good deep coughs. That's what we're looking to do. We're trying to open those lungs up for you, all right?
John Dye, for example, got a fast-track lesson on working through COVID as a student nurse at the VA hospital in Boise.
It was rough, especially a couple weeks ago. You know, we had a lot of COVID patients. They were having to adjust how they operated in order to be able to take the overflow from, you know, Al's and Luke's and other places. We were even getting people that were coming in from Montana and northern Idaho.
Tough work conditions inside hospitals has simply taken a toll on Idaho nurses, burning them out of the job. It's something program leaders address head-on with students.
Nurse burnout is real, and that's something that, you know, again, COVID has forced us to kind of look at how are we getting our students ready, and that's actually a major component of what we're trying to get students to really understand, is that as much as they want to give, as much as they want to help the community, it doesn't matter if they aren't taking care of themselves.
Nurse burnout, which is 100% understandable, is leading to more and more professionals leaving the field. These students know what they're heading into after graduation, begging the question, why are you doing this?
I never hesitated, like, as the pandemic started, in my decision. You know, I knew that, you know, I'm going into this to help people, and I'm going to help them no matter what their, you know, illness is. And so I know that there's going to be a lot of stress, and I know that there's going to be, you know, fear and everything else involved. But that's part of being a nurse. Like, there's, you know, if it's not COVID, it's going to be something else. And so I just, you know, saw this as a great experience in sort of how bad things could possibly be. And I figured if I can make it through nursing school in the middle of a pandemic like this and I still want to be a nurse, then it's probably the right thing for me.
I mean, going straight into the fire, you at least get an idea that they know what they're getting into and they really want to do it. So that's a good thing. But other than like, say, intubating, we're putting that tube down a patient's throat. What other COVID-specific simulations are out there for them?
Well, one thing they're working on, Brian, is telehealth, because with COVID, telehealth has become a really big resource for hospitals and medical centers, where if you don't have to have somebody come in for treatment and you could say, okay, do this, this, and this, and go fill your prescription, they can avoid leaving the hospital. So the nursing students are now working closely to learn about telehealth and how valuable it is. Of course, with COVID, there's a lot of emphasis on PPE, as well as things like respiratory care. COVID has certainly given some emphasis to the nursing field, and it'll be interesting to see really as this class of nurses goes into the field, how they deal with the stress.
And obviously this is something that takes years. You can't just solve this nursing shortage overnight, so at least this is the step in the right direction. All right, thanks, Joe.